afternoon, everyone. Good afternoon, one and all. I'll be presenting on this topic. The authors of this study has no financial disclosure or conflict of interest with the presented material in this presentation. During the pandemic of COVID-19 SARS infection, India has experienced a surge of dreadful fungal infection, rhino-orbital cerebral mucormycosis. And mucor is a saprophyte of order Mucorales, and mucormycosis is an acute and often fatal opportunistic infection. The conventional management includes control of the metabolic abnormality, administration of metabolic systemic amphotericin B, and surgery that involves simple sinus clearance, radical debridement, and orbital exenteration. Orbital exenteration is a surgical removal or orbital contents, including the eyeball. Exenteration is performed as a life-saving measure for primary or secondary orbital malignancies where conservative treatment has failed or is it not feasible. So exenteration can be performed by either an eyelid sparing or eyelid sacrificing technique. Ideally, the eyelid sparing technique with suturing of the eyelids is preferred. However, most of the patients developed wound gaping. Some surgeons advocated spontaneous granulation where orbital cavity has to be lined by temporalis muscle, forehead flaps or grafts, and this offers comparable cosmetic results. However, healing by granulation takes longer time and requires intensive post-operative care. This is one of our patient who a post-operative eyelid sparing technique with complete no gaping. And the second picture shows that there's a lateral orbital wall gaping. And the third one is the post-operative patient of eyelid sacrificing technique. And the fourth image is it's a post-graft anterolateral aspect of thigh graft. Then the purpose of the study is to study the epithelization of orbital socket and to compare the post-operative outcome in eyelid sparing and eyelid sacrificing techniques post-exenteration in COVID-associated rhino-orbital cerebral mucormycosis at a tertiary eye care center. In the materials and methods, it's a prospective interventional study conducted at a tertiary COVID-19 hospital between May 1st, 2021 and July 30th, 2021 for a period of 3 months, where 35 patients were subjected to relevant medical history, ocular examinations, and patients with visual acuity, no perception of light, pupil dilated and fixed, severe ptosis, proptosis, with or without involvement, incomplete ophthalmoplegia, and extensive involvement of the skin over the eyelids and bilateral orbital involvement were subjected for exenteration. And patients were divided into two groups based on the surgical technique performed, namely the eyelid sparing as group 1 and eyelid sacrificing as group 2. And these patients were followed up for epithelization of the orbital socket in eyelid sacrificing and wound healing in eyelid sparing exenteration over a period of 4 weeks. So our observations were gender distribution. Out of those 35 patients, 18 and 17 were included in eyelid sparing and eyelid sacrificing technique as group 1 and group 2. Of them, 27 were males and 8 were females respectively, with a male preponderance. Coming to the orbital socket epithelization at 2 and 4 weeks, medial wall of the orbital socket healing at 2 weeks showed no granulation in 4 and 2 patients, granulation in 14 and 15, whereas lateral wall showed no granulation in 13 and 10, and granulation in 5 and 7 respectively in group 1 and group 2. By 4 weeks, medial wall showed granulation in all the 18 and 17 cases, and lateral wall showed no granulation in 2 and 1 cases, and granulation in 16 and 16 cases at 4 weeks respectively. Coming to the wound gaping in the at 2 and 4 weeks in the eyelid sparing technique, at 2 weeks and 4 weeks showed medially in 13 and 8, laterally in 1 and 1, and total in 3 and 8 respectively, showing the wound gaping was seen more medially, followed by total gaping. So coming to discussion, it's a study done by Honavar S.G. Rao sir at a study on enucleation and exenteration in surgical ophthalmological oncology concluded that these procedures can be life-saving and are used as a part of multimodal treatment in achieving the complete local remission. This cosmetic disfigurement caused by these radical procedures must be rehabilitated by a well-matched processes. So the core article was by Putterman AM et al. And study on orbital exenteration with spontaneous granulation. It was observed that spontaneous granulation technique provided better results when compared to the split thickness graft technique. In a study done by Rahman et al. Orbital exenteration, a 13-year Manchester experience, it was found that healing of the orbital defect is dependent on the method used for reconstruction, and they included temporal muscle transposition, midline forehead flaps, dermal grafts, split skin grafts, eyelid sparing technique, and spontaneous granulation, allowing the granulation of the defect healing by up to 2 to 3 months. Healing by secondary intention has an advantage of being an easier and a quicker procedure that allows reoccurrence to be detected early. And however, in cases where exenteration is performed for palliation of the neoplasm, a split skin graft give rapid rehabilitation of the socket and minimize the hospital attendance, but lengthens the duration of the surgery. So This is another study, Gunlap et al. And this study also showed that there's a spontaneous granulation proved to be a simple technique and produces cosmetically better results for patients not wearing prosthesis. However, there were been limited studies elucidating the epithelization of postoperative outcome of orbital socket post-exenteration, hence this study. And this is one of the same patients who went eyelid sparing technique with no wound gaping. This is the post-op eye patch with a spectacle mounted prosthesis. And the conclusion of my study was this comparative clinical study showing eyelid sacrificing technique with spontaneous granulation has early and better granulation tissue formation in comparison to eyelid sparing with wound gaping and a delayed granulation. And these are my reference. Thank you.
I wanted to ask, how did you randomize your patients into group 1 and group 2?
Ma'am, depending on the extent of involvement, like in the eyelid sparing technique, there was extensive involvement of the skin of the eyelids. So we have divided based on that into eyelid sparing and eyelid sacrificing technique.
Okay. Yeah. Thank you.